All right. Courtney, how are you today?
I am great today. Yes, thank
All
you. It's
right.
great to see you.
It's good to see you as well. We've kind of known each other for a little over a year. I can't believe it's been over a
Oh.
year now. But you came to see us about a year ago. Tell us what was going on then and what was the thought process behind deciding to come and see Anne and myself.
Yeah, I found out that I was high risk for breast cancer and had one of the genetic mutations called POLB2
Mm-hmm.
uh, that increased my chance of getting cancer to 40 to 60% in my lifetime.
Right.
And I just decided to take a hard pass on cancer, um, and and wanted to do something preventative. But my biggest concern was I didn't want to be numb for the rest of my life. I was 39 last year when I had the surgery, and I just feel like I had a lot of life left to live. And I just couldn't get over the thought of how weird it would be to not be able to feel anything between here and here. Like that just that complicated my decision to do something preventative for
Right.
quality of life. And and then when I heard about the idea of sensation sparing or nerve sparing, that really clicked in my brain and was like, well, now this is a no-brainer to do
Mhm.
a preventative surgery and take away that risk factor as much as humanly possible while still maintaining my like some sense of normalcy for my
Right.
body. So that's why I decided to go with you guys, and I came down from Oregon to do
Mhm.
it, and really glad I did. It all worked out perfectly. I'm really, really happy with the
Yeah.
results.
So let's kind of dig or drill down on that a little bit. It's been a little over a year. Um, Tell us about, first of all, I guess the appearance. Does everything look how you'd hoped it would look, pretty much?
Yeah, yeah, that's it's something that I've joked about because that was another big question mark for me is I've seen post mastectomy photos and they just generally don't look great.
Mm.
But then again, finding Anne and yourself, I started to see more and more pictures of your guys' work. And I remember when I met with Anne and she was like, what are you going for aesthetically? And I was like, well, can you make me look like when I was 22? And she was like, yeah. And she did. And so I'm really happy with the results. I feel very natural. I feel just like myself, but before I breastfed two children.
Right,
Uh,
right.
so I'm super happy with the way they look. I'm super happy with the way they feel. It just most days I forget. And I think that's the very best possible experience post mastectomy.
Yeah, yeah, that is so. Just for anyone that might see this, what we ended up doing was actually finding and being able to preserve nerves on each side, the main ones to that central breast mound. Um, and that's actually a fairly unusual thing to be able to do. Oftentimes, you have to cut and reconstruct a nerve, which ultimately has results very similar to what you're describing. But in your case, we were able to preserve nerves on both sides. And so, I mean, I think you said it all. I think that the real goal for us is to, you can have nice oncologic outcomes, which is the most important thing. You can have a very nice aesthetic outcome, but if you can't functionally feel anything, you never quite feel right. And you're always reminded of the fact that you had, breast cancer, that you have a genetic predisposition. So you chose to do this. And so again, what you said is, I mean, I couldn't have said it any better yourself. So we're so happy that you've done so well. Um, Please feel free to reach out, as we've said in the past, at any point in the future if anything changes. And I really appreciate you taking the time to share your story.
Absolutely. Thank you.
Thank you.